A warm welcome to all of you. We have spent 3 days together learning, sharing, unlearning, and growing individually and as a community with the hope and dream, how might we advance health and well-being in our local communities, in our countries, and around the world.
So welcome. My name is Edelweiss Aldasoro. You have seen me in some sessions. It was a pleasure to meet you all. I'm part of the IFIC team. Thank you so much, everybody, for the support. And we are going to co-chair this session together. So today.
I'm Jodeme Goldhar. I have the great privilege to hold the role as Vice Chair for the Board of Directors for the International Foundation for Integrated Care, and along with Dr. Walter Watchus, lead one of the hubs, the North American hub for integrated care, which is often referred to as IFIC Canada. My personal commitment to the community that advances integrated care around the world is because I see firsthand how much we care about making a difference, how we want to relocate power to health and well-being, and how everything we are doing individually and collectively is how to listen to the signals around what is most important to people and their families, and how our health and care systems, despite best intentions, may not be designed in our current form to achieve those goals. And we are part of a social movement that is going to make that happen, and where it is already happening, whether it's in our local community, within our country, or across the globe. This is an ongoing, active way of working. This is breaking down silos between us. It is also about what we need to do within ourselves to continuously be explorers and learners. We each have something so valuable to contribute, and we each have something to continue to learn, because integrated care, we are never done. It is constantly evolving as people evolve to understand what is most important for people and their families and those of us that work in health and care. Today's session and how we are anchoring the finale to our 3 days is centered very intentionally around making integrated care happen, supporting the health and care workforce, and meaningfully using digital solutions and shared data for information and care management. And what might that mean? Edelweiss and I, along with our esteemed and wonderful panel, really want to offer a provocation. When we talk about workforce, what do we mean? Who's in? It means all of us. Residents of communities, often referred to by themselves service users, carers, which friends and families that support people who receive care from health and care, and those that work all across health and care. And the provocation is, so how might we leverage this to either be an enabler or not? So as we sit here and think about our opportunity, please consider your own experiences with digitization, technology, information, and data. How might it serve as an enabler, and when does it serve as a barrier for change? Edelweiss is going to build on that provocation.
A pleasure. Can I take this?
Yes.
So, I would say that we all have great expectations in the digital tools and the technology development to support us in this, can I use the word journey again? Was that like, I don't know how many times, towards integrated care. Can I ask to the audience, please put your hands up. Who has great expectations with the digital transformation? Who has fantastic experience with the digital transformation? Great. So I'm going to talk specifically, so this is not an evaluation, it's not a systematic review, it's just some snapshot of some of the experiences I've heard during the conference combined with my own. And we are hearing, because we know many countries, many regions, they have like great expectations, how coordination and care management is going to be improved when they get, if they get electronic health records. But can I also tell you my experience? This is not what happens with electronic health records, but this also happens when you put electronic health records. I'm going to tell you a short story that this was my routine when I worked in a hospital. I am an internal medicine physician who works, that specialty is for the hospital, mainly multimorbidity, mainly complex cases. I am old enough to have worked in 3 different systems before electronic health records. And I'm going to tell you one routine. We started our work every morning, every day, 10:30. We would visit the microbiology lab. We would enter, good morning this, good morning that, how are you? I'm fine. I've got this list in my to-do list today. I've got to ask all these questions about those samples. Yeah, no results here, no results here. This one is showing something. Would you like to see? Yes, sure, like show me. And they said it's a sample. Okay. So I've got this person in this antibiotic. You know what? Actually, in that facility, we are seeing increased resistance of that antibiotic. Shall I change it? Yeah, you should. Fantastic. You go upstairs. Oh, the nurse, by the way, they called from the lab. Like, that person has this problem, it's urgent, please solve it. So it's kind of like everything was based on communication, conversation. We knew each other, we trust each other. It was informal. This is only one example, but that this repeated with many other specialists we were in contact with. Is there any health practitioner here who works in this type of context where you have to talk to each other? So now I'm going to go to another phase. I'm going to talk about WhatsApp, and this is going to sound very, very strange, but maybe even these days, have you get a WhatsApp saying like, did you sleep well? Yes. Are you eating? Yes. It's raining? No. Thank you. We'll talk tomorrow. Would you say that's communication or just an information that you're alive? So sometimes the experience with the electronic health record is similar. You convert all the informal space and communication and connection with colleagues into a formal space. And what happens is that when you then ask, when you have electronic health records, you go on and ask, but do you have any suspicion? And they're like, wait until I give you the final results. Yes, but last year you would give me like a hint. Yeah, but this year we've got electronic health records. So you wait until I've got the final results. Because you wouldn't dare to write your suspicion in a formal environment. You would have a situation where you would thinking, oh, maybe it's time for discharge. And you go to the nurse and you say, okay, so shall we start planning discharge? And in an informal environment, they will tell you, I'm not really sure, something is off. Every time the family comes, he gets really, really excited, and he gets really anxious. And I'm not really sure it's safe to actually send them home. Would you write that in an electronic medical record? You would never. And the same thing with mental health issues and many other sensitive information. So suddenly it's not you are missing something if you rely everything on electronic medical records. But also, and this is fun, I said we were like taking the profile of the people I used to have in my list. They were complex cases. So you ask for a blood test. Have you ever seen a blood test of a person with a complex condition? You can count asterisks. It's like 40% of the variables have asterisks. They don't mean anything. They've been like that for 20 years. But suddenly when you've got electronic medical record with alerts, you've got like 200 notifications at 8 in the morning. counting down how much it takes for you to verify and validate all of them. And most of them have no importance because they've been there forever. So suddenly you lose this capacity to differentiate what is really important information and why I'm being bombarded by information. So this is the feeling usually when you have this transition. And where is the connection and the time for communication with the person you are taking care of? Can you see, like, where is Wally? Do you call it Wally in English? Where is it? Somewhere there, right? Like between all these notifications and blah, 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 blah. And I was in a session the other day. I apologize, I forgot the name of the author, but they said, when you are doing this type of transformations and change management, really engages with people if there is joy. I've done the transformation from paper to electronic medical record 3 times. Any other people who've done the same thing? Nobody? Only me? Thank you. So usually it comes like this, at least in my experience, and maybe I was lucky enough or unlucky enough. Usually they come and they say, well, in 2 months, we are going to stop providing paper. So you know the patient, you know the story better. So why don't you summarize all the cases, all the paperwork, like usually a couple of books, like 3 fingers, in 2 months. And since then, it's stopped, everything is electronic. And what you cannot summarize is going to be scanned as one document. So you just got and actually, and this, we don't talk about this enough, but when we talk about information, and we've been asked many times, please, if you are my reference practitioner, don't ask me the same question all the time. But then the beauty is in the details. And when you have to summarize something in 5 minutes, there is no detail you can maintain. And have you been in sessions talking about how important and how much we can do if we take data-driven approaches? We've never had so many data. Have you been in sessions like that, in projects like that, in contexts like that? Nobody? Okay, all of you. And the feedback usually is like, nobody understands what to do with data. We don't understand what it means. We don't have enough information. So how are we going to solve this? Like, are we going to bring somebody who knows what to do with data to the team? Are we going to teach the team what to do with data? Have we solved this? Doubtful. We said that workforce is everybody, and we cannot forget. I'm just going to mention the carers, for example, here. And they've been like brilliant examples, trying to compile information and knowledge and put them on the website. Have you talked to them how easy it is to access those? Do they have time to go there and read the 150 documents you have built so that they can actually give insulin and make sure that they know the variables and they know how to change depending on the context? Does this work? I'm not talking in the name of anybody, but when it was my time to do that, I did not have the time. But when I was in contact with a nurse and I could ask and they had time, in 2 minutes, I understood it perfectly. So, yes, and I haven't mentioned this. There is, are you familiar with the comic Yes, But? I invite you, like, it's like really good, and that's why I took this approach, because yes, like I do believe that digital technology and digital tools and technology have a role in advancing toward integrated care. And it's part of the cake. I'm using just the 9 pillars here. But let's go back to square one, because this is not about success or failure of the digital tools. The thing is that unless you change the mindset, unless you situate in a model of care that is including all the factors related to integrated care, until you consider the whole cake, The digital tools are not going to solve our life. They are just a complement of it. And so sometimes the feeling is like from great expectations. We're like, yes, promises, 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 very good. And if you read the papers, I love this, because it's kind of like, yeah, meaningful of digital solutions and shared might support, may support. I love, like, English verbs are really like explicit here. But do they support? And we haven't proven that many times. We're going to have examples now, and I don't mean that they do not. I'm just trying to ask, do they do it on their own? And I'm going to finish now with two things, if I'm allowed to. One thing is that I hope you all have a fantastic experience with the conference, and I'm pretty sure you remember how easy it was to contact the team by email, and how good was the submission portal, and how brilliant is the app. And probably that was the best thing of the whole conference, wasn't it? We received an email from, and I would like to thank you because we've got people watching us from long distance. And we've got a friend, she's Kera from Canada. And she sent us, we are working with her, and she sent us a piece of work. And at the end she said, what can we do more to support the caregiver in the role of caregiving at home, and how do we address the impact on them? And I asked her permission to actually translate her question here. We haven't answered this during the conference, and we'll leave this open for the panel, but also for the following conferences. And final comment. I thought in a previous session, Carol Hope from Queensland said, she put a slide, and she said, call to action, 3 things. Let's see if you agree. 1, connect with your community. 2, bring all stakeholders together. And 3, co-design potential solutions. Happy for you to continue adding things to the list, but I think that was a great summary. So with that, Jodeme.
Thank you, Edelweiss. So as we hold a number of truths, when we asked everyone to raise your hand if you believe in the possibility, 95% of the room, and perhaps those online all over the world. We had 1,300 people at the conference, over 2,500 interactions through a virtual connection. The possibility is sitting right here. And when we asked, what are you currently experiencing? There's such an opportunity. And what we're hearing from the opportunity is that connection is the correction. As we think about the opportunity for digitization and to connect up in these ways and the use of data, our mind and the provocation is when we think about the design, we cannot lose the element of connection is the connection. We have set up this panel really from a multiple perspective to say, so what is our possibility? What is our current experience, and how might we reach the possibility that is sitting and we are holding and we believe to be true, and that we hope that coming together as a global community and a social movement for change will help enable. So our esteemed guests today, we're first going to hear from Birthe and Dan. I know you've had an opportunity to look at their professional bios, and as you each take the stage, what I would ask of you, please share something about yourself, to introduce yourself, perhaps what's not in your bio, or perhaps what's in your bio that's important to you as you share what you're going to speak about today. Birthe, welcome to the stage.
Thank you so much for the nice invitation to come and give a talk at this conference. When I did my PhD in 2007, Gus Shivers, who was one of the founders of this network, he came all the way to Denmark. And at that time, some of the first conferences, there was only maybe 100 or 200 people. So I have followed the network since, and it's been a great pleasure. At that time, I was doing home hospitalizations of patients using digital tools in 2005. I couldn't get funding in Denmark, but I succeeded after half a year and 37 applications. And since then, now I'm coloring my hair. I'm getting older, but now digitalization has really evolved, and I've been one of the pioneers in Denmark. And I would like to take you along the journey we have had in Denmark and tell you about what we have learned so far. So my agenda is, you have a beautiful coast here in Ireland, but we also have in Denmark. I would like to give you a status of where we are on integrated care and digitalization, what we have learned, possibilities, but also the challenges, and how we're going to navigate the future, both by strategies and also what are future research. So here's Denmark, for the ones who don't know Denmark. It's a little country. Sometimes I say it's like a little part of LA. We have our capital is Copenhagen. We have 5.9 million inhabitants. We speak Danish. We are a welfare state. We pay a lot in tax. I think sometimes over 50%. I don't know how many would like to do that. But then we have free school. We have free hospital care, district nursing, free elderly care, healthcare centers, and also free going to the GPs. We had 3 levels, so when we talk integrated care, we have 3 levels to look about. The national level are the health authorities, the regional levels are the somatic and psychiatric hospitals and acute medicine, and then the local level is district nursing, elderly care, GPs, dentists, and so on. So what we started in 2003, I think, has been very important for Denmark. We built the Danish e-health portal. That means you see the yellow card there. Every Dane has a card in their pocket. And we have an individual number. So we have, each Dane has a number. So we can follow all the Danes from grave until they are dying. So by using this number, we have the sky in the middle, Sundhed.dk, or the e-health portal, where you can look in your electronic patient record. You can see your medicine, you can see prescriptions, you can see your agreements with the hospital. 2 years ago, my husband had birthmark cancer. We could follow everything. We could even follow the scans before we were going to the hospital to talk with the doctors. What the scan has said, he's free of cancer now, so that is good. We are reading that now over times. We can see results from blood test and video. So here you can go as a citizen, you can go as a healthcare professional, both from the hospital, the GPs, and the healthcare center. Yeah, and here you can see how it has increased the numbers, how the Danes are really using this e-health portal. We're talking about now having a version 2.0, so because it's going to be even more interactive than it is today. So people are really using it. The Danish healthcare system is really digitalized. So we have 2 electronic patient record in the hospitals. We have in the 98 municipalities about 20 different systems. But even though we have integration and sharing data between all these stakeholders. So all data is also linkable. So because we have this data from when we are born and you get the individual number, you can draw and you can also go across the registries. So in fact, our foreign ministry is telling Denmark, come and do research if you would like to do that in Denmark, because we have very good clinical data. We have just implemented national implementation of home monitoring for COPD patients. We have for heart failure patients, and we will do for diabetes by the end of this year. Integrated care and digitalizations. When you've been admitted to the hospital, there's a digital message to the district nurse, to your own GP, to the healthcare center if you're going to go there. You can do video consultation by all from the hospital and outpatient clinic. You can do by the district nursing. You can do with your GP. They are just a little, they're not that fast like the other actors, but they are coming there. You can have chemo at home. You can also have your wood, so you scan by a nurse in the homes and then talk to the doctor so the patient don't have to go to the hospital. So these are just some examples of where you can see the digitalization and the integrated care. So what have we learned so far? Well, the possibilities for the patient is that it has really improved the coherence and the continuity of care. And video consultation has really had a boost after the COVID-19. It saves time. Even though we're a little country, it might be that we have remote areas. So patients with complexities in chronic conditions, they save time going to the hospitals. And by this national e-health portal, we have one entrance to the healthcare system. And so you have all your health data in one place. You can have overview of waiting times. If you're going to have an eye operation, you can see what hospital would be good to go in Copenhagen. Maybe they have 5 weeks. Maybe I should go to another town where they only have 2 weeks. But also overview of your medicine. All this digitalization has also brought the healthcare professionals to be very innovative. So concepts like hospital at home, I did my PhD on hospital at home in 2007, but now it's being implemented that you can be admitted at home. Telerehabilitation, training at home, all these new technologies. So the municipalities are the ones that are responsible for rehabilitation of patients. They have taken it up. And we have evidence for that you can integrate your activities into your everyday life. You can increase motivations and also the empowerment. And the home monitoring, I know from all of your countries from all over the world, you have done that for years, but we are happy that it's everyday life now, feeling of security, empowerment, and patients can look at their symptoms before they have to be admitted so they avoid admissions to hospital. Some of the challenges, even though we are facing our privacy and on GDPR rules, but also this digital literacy. How do we match patients with the right technologies? How do we access the technologies? At the moment, it's the welfare state that are giving the patients, if they are on a monitoring program, an iPad. But I don't know if we can afford that over time. Also interoperability, so that we can hinder the seamless exchange of informations. We also have, like you probably can recognize, loss of personal interactions, data overload. I had a heart patient last year. She was, even though a teacher, she said she was measuring sleep and physical activity, blood pressure, pulse, and weight. She said, I can't read all this data. What does it mean for me? I need the project nurse to help me to say what all this means. So we have some issues there, and also the legal issues. And quality of healthcare apps, so it's just been decided by law here from January 1st that our e-health portal, we are going to validate all apps before they get on the portal. For the healthcare professionals, we can see increased communication and coordination. It's easier, it enhances the quality of care. And also the virtual consultation can help to the underserved areas for the patients. We see this new concept, so I think it's really great to see that we can have new way of making new services for integrated care, and it also increases the patient's engagement. And of course also continuing education and training. Even though when I was sitting with my husband in the outpatient on the oncology ward, there was a lot of paper, and even though we would like to brag a bit in Denmark that we are first movers on digitalization, there were too many papers there. So I think sometimes we have lack of hands at the moment. It's a global issue that the healthcare professionals, they don't have time to think about what they could do with the digitalization. Also, data analytics and decision support, that's what we can do because we have these unique numbers on the patients. So we're really taking next steps on AI now. And also for automated administrative tasks, so we can help, we're looking at how can we help the nursing and secretaries at the hospitals to work smarter and not harder. Challenges is that Treatment plans. We need to have treatment plans if you're a psychiatric patient, you're being discharged. There's sometimes, I would say too often, there's no treatment plans made or shared before the patient is discharged. So that's a big issue, one of our next challenges. We have these 2 electronic patient records in Denmark, so it also gives us some issues. And civil system out in the communities. So we're working on making integration between them. The legal issues, and then I have to admit, even though I think I might have some colleagues that would say we're very good at implementation, as a professor in digitalization, I think we've been too slow. Too slow from when the evidence is there. In 2014, I had a paper that we could decrease readmission rate on COPD patients with 54%. And it wasn't before last year that we implemented it, because the 5 regions were discussing how to implement it in the best way, how to make integrated care in the best way. So I like saying, not too much talk, but let's do it. Because, patients are suffering. We could see they were suffering. So lack of hands on digitalization and work smarter, not harder. Health equity, I really think we haven't solved that yet, like many of you haven't either. Ethical issues. And then also these tools for assessment of e-health literacy. I haven't seen anything in the literature yet that I think that we can use, so I hope many of you would help us move forward on this area as well, because that's very important, so we don't lose patients. So how do we want to navigate the future? Well, in Denmark, over the next years, we want to move closer to the patients, closer to the communities, especially citizens with chronic disease, but also acute functions, because we don't have beds enough in the hospitals. So we want to have acute teams out close to the patients. We want to have near hospitals for treatment, closer to the patient's home. It's not a patient's home, it's a summer house you can see on the picture. So we are not that little a country. But we also want to have more treatment with digital tools. And we have a new committee that in June is going to launch ideas for a new way of structuring the healthcare system. And it said it's going to be digital first. So I'm looking very much forward to see how the committee will come up with ideas on that we don't make A and B patients on digitalization and integrated care. So our strategy is better use of health data. We're really putting an emphasis on that. More treatment at home with digital health technologies. Modernization of legislations within children's psychiatry. And also doing the National Health e-portal better to give a better overview for patients when we take care of the e-health or consider e-health literacies. So I've been working this space for many years now, so I just wanted to give you 2 examples of how I'm trying to take it to the next level on this integrated care and digitalization. And one is with patients with atrial fibrillation, where we want to make quality of life. Today in Denmark, the patients, it can be a man who's 48 years old who goes to the doctor, and suddenly he has got atrial fibrillation. He gets 45 minutes by the doctor, and that's it in Denmark. So we made a program, and doing an RCT study, we are supported by the Danish Heart Association. We made the heart portal. It could as well be our national e-health portal, where we have all the informations, and the patients, they have like a digital toolbox. So we are in the middle of RCT, where one of our patients says, I feel good knowing about my disease. They can see all the values that they are measuring here, and at the same time, they're taught about their disease. The other project I just want to mention is on telepalliation. Patients who are in palliative care, where we have built, we are testing and implementing and evaluating a platform for patients in palliation. And here we've done a randomized controlled trial with 182 patients. And here we have communication modules, we have informations, patients reported outcome on pain, on quality of life, on feeling of security. And we here have patients saying that they can see when they don't feel very well, that their pain is decreasing and the feeling of security. So it's been a very strong project, and we have results coming up here by the fall. So this is really a very good example of how digitalization can help families, because they have many healthcare professionals coming. When you're in palliative care, it's a big prioritized in Denmark, but I don't want you to come. Only when it's necessary, because they want to be with their families. So here, by having video, we have had families where they had a son in Australia that he could participate over the platform in the care and the necessary dialogues with the doctors and nurses. So these are just examples of how we can do research and how we can make evidence and move the system along. So patients say it facilitates communications, makes illness and symptoms easier to understand, and they have a greater sense of security and of freedom. Some things it's overwhelming too, and then they drop out of the study. So these are just examples of how I try all the time to make integrated care and digital technologies, and I always start my projects by user-driven innovation and then building the system upon that and then making the evidence. So thank you so much, and you can follow my work here, and I put references in my PowerPoint when you are looking at that, if you want to have a look at that. Yeah.
What's incredible to me in listening to Birthe and hearing what you shared first around how you started this journey is you've been part of this community for a long time, and you believe in the possibility that's sitting there, and you've also gone to let's get it done. And it sounds like with the values of connection is the correction and really paying attention to what's most important to people and their families. Dan, as you come to the stage, please share what brought you here, or something about yourself that's not in your bio, or something about you within your bio that's important to share with our audience as you share your own experience in enabling people and families as a result of using digitization. Welcome.
What's fantastic to me here is that Birthe has just done a better job than I will be doing of my presentation in her second language. Good afternoon, everybody. It is an absolute privilege to be stood on this stage talking to you today. For those of you who were here on Monday, if you remember back to the first plenary session, there was a lady called Sharon Gallagher who talked to you all. So Sharon and I are colleagues. I'm one of the local people from Northern Ireland, although I'm actually English. So I get affectionately referred to as a blow-in. At least I think it's affectionate. So I am a Deputy Secretary in the Civil Service and the Chief Digital Information Officer for Health and Social Care in Northern Ireland. And I hope that as a local representative, you guys have had a fantastic time at the conference here. Belfast is really a wonderful place, as you've all seen, I'm sure, getting a few nods. And we did order the good weather, especially for you. So I am going to talk to you about the digital angle from the Northern Ireland perspective. Birthe has given a great set of examples there. I'm going to take a slightly different angle on my remarks here today, thinking from an enterprise architecture perspective. I haven't managed to get to the whole conference, but if I just try and characterize some of the themes that I heard in the time that I was here about what integrated care really means today, it's about increasing person-centeredness of care, improving outcomes with earlier interventions, and a focus on maintaining wellness and not treating illness. Removing inequalities, Sharon quoted, leveraging collective assets better as we plan, commission and deliver services, and building stronger partnerships across and outside organisations in the health and social care sector. So, like Birthe did, I'm going to give a little bit of a summary of Northern Ireland. Given that we are here, you've probably seen some of this, so I'll canter through it fairly quickly. We are 2 million, just under, souls on board in the province, and there are 6 provider trusts in Northern Ireland. 5 health and social care integrated provider trusts, that's a key point, and 1 ambulance trust. We've got over 6,000 beds, over 80,000 directly employed staff members, about an £8 billion budget to deliver in the public ecosystem, our health and social care services, and over 320 GP practices. It is my job in the department as the Chief Digital Information Officer to develop the vision and strategy for how digital and data will help deliver better health and social care outcomes and experiences in the region. Asking an audience to get their smartphones out in a presentation is always a little bit of a risk. But if anybody is interested in how we're going about setting that vision and the journey, because we're all on a journey, aren't we? The journey that we're taking from a digital perspective, you can hover over this wee QR code here, and that will take you to the mini site on the Department of Health website that sets out our digital vision and strategy. That isn't one thing, it's actually four. A data strategy, an innovation strategy using digital to innovate, a cybersecurity strategy looking after data and ensuring that we can maintain privacy, one of the points that Birthe made, and then an overarching digital strategy. You'll be able to find all of those documents and read them on the plane on the way home to your heart's content. The investment programme that comes behind the achievement of that strategy includes delivering lots of large programs and projects and doing lots of heavy lifting from a technology perspective. That's my background. I'm in technology delivery. We are, just to give you a few examples of that, replacing the canonical electronic master patient index. So the numbering system that Birthe had talked about in Denmark, we are replacing one of those here. So there is a consistent health and care number with a modern master data management approach to how we look after that information. We're then delivering a single enterprise level integrated electronic patient record across acute physical care, mental health, social work and social care and community nursing. And I'll talk a little bit more about what that brings us in just a minute. We're replacing all of our medical imaging technology, all of our laboratory systems. We're replacing all of our back office enterprise resource planning, the kind of back office finance, shared service and procurement solutions. We're building new e-pharmacy systems. We're developing a new data institute. So there is an awful lot going on all at the same time in the digital space, and it does feel a bit dizzying at times. The big program that you might have heard people talk about this week, it's called Encompass, and that is the electronic medical record solution. We're rolling out a system called EPIC across all of our 5 provider trusts. I was going to talk a little bit about why we're doing all of that. So what are the actual benefits? But I thought I would use this as an opportunity just to come back on Edelweiss's comments about keeping humans at the centre of our digital investments. That is absolutely key. Bringing our staff along and having the workforce enabled by technology so that they can operate at the top of their license every day and do their best work is one of the key goals of our strategy. And I'll talk a little bit more about how we're doing that. One thing I should mention is on the stage today is one of our patient representatives on that Encompass programme, Joan, who may be talking to you shortly. So I'm really proud that we can demonstrate even here today we are bringing human beings, actual human beings, along on the journey around all of this digital delivery. So I'm going to build really quickly a mental model for us all about the complexity of how integrated care can be achieved. So bear with me for just a minute, and then I'll talk about digital interventions from an enterprise architecture perspective and give us a little bit of a school report on how we're getting on some of those things. So if we think about human beings, service users, patients, social care clients in the centre of all of our models, normally it's a circle. In this case, because I'm only really half qualified to be here, I'll have a semicircle. That's probably the best way to proceed. So they're at the bottom in this model. And then we've got our primary care settings, community pharmacy, general practice, telehealth and telecare, and increasingly, and we've heard already in this session about it, self-care. What are the things that one needs in order to enable the workforce to be able to operate in those settings from a technology perspective? So we need to talk about collaboration, we need to talk about workflow orchestration, we need to talk about integration, and we need to talk about the longitudinal patient record. So if we then build this model out and we think about other settings and services that are all involved in the delivery of successful integrated care outcomes, social work and social care, community nursing, ambulance services, acute hospitals, including inpatient, outpatient, elective, urgent and unscheduled services, mental health and intermediate care, and all of those settings have those same requirements. How do we enable the workforce? How do we get them to collaborate more easily? How do we orchestrate and manage workflow across different organizations and teams and silos? And then the final layer of my onion as I set out this mental model here today, we need to bring the government and commissioners, education, research and innovation, and then private sector operators in domiciliary care, nursing care, hospices, private health provision itself, and third sector organizations. So let's start thinking about how we react as technologists from an enterprise delivery perspective to that very complicated ecosystem. So you need to build a longitudinal care record. Northern Ireland gets an A+ in this regard. We put ours live in 2013, and it has an increasing number of professionals across all of those different settings and services able to follow the data of a patient, the coefficient of integrated care. Think then about collaboration. So what are all the tools that people use today? How do we uniquely identify our staff members? How do we uniquely identify citizens and service users in a way that allows them to build a digital identity and a trusted relationship with digital services? So we are doing good work. Most entities around the world involved in delivery of healthcare during COVID, to a greater or lesser degree, deployed something like Office 365 to all of their staff members to allow them to work in a new standardized way, in the way they do video communication between each other and video communication with patients, and then collaboration across different services and teams. I'll give us a B- on this one. So we've rolled out the technology, just as everybody else did, frankly, during COVID, but we haven't really finished off the business change around that. How do we get the full value out of the investment we've made in Microsoft technologies? So then I'll talk a little bit more here about Encompass. So this is, for those of you in the audience that are philosophically predisposed to integrated best-of-breed technologies, you're not going to like this bit, right? We've gone full down the monolithic route. We've bought Epic. We're rolling Epic out everywhere. It is a huge challenge. And thinking about how we bring professionals along on that journey, it's really hard. Sometimes it's harder to interact with a computer system than it is to pull a pen out and write some notes on a chart. So that is in rollout at the moment. We've gone live with the first trust. They went live in November last year. And just today, I've come from the Belfast Trust from their programme board meeting. We go live in June. Belfast Trust, as you've probably heard this week, is the really big kind of tertiary teaching hospital in the region. So I've given us a future A+. This is where we're going to be in about 18 months' time. I've given us an A+ for rolling out this massive monolithic programme. So then if we go to digital pharmacy and electronic transmission of prescriptions, so how do we get community pharmacy and general practice better and more tightly integrated to deliver pharmacy-first services to take pressure off of primary care in a way that the pharmacists have been clamouring for years, but we haven't really properly enabled either with policy, commissioning, or data and technology. So we're going to be delivering, this is one of our to-do list items, electronic transmission of prescriptions, and essentially a patient relationship management system for pharmacists to be able to deliver services on behalf of GPs. And then technology-enabled care. So how do we do support for self-care? How do we use consumer-grade technologies? How do we bring data back into a new risk management construct around how primary care in particular manages chronic diseases and how we can deliver increased independence for elderly citizens living in care environments? So we are actually pretty good on these historically. We've delivered social care enablement through telemonitoring services. That needs a bit of a refresh. So I'm giving us a to-do list item there as well. And then finally, the coefficient of all integrated care is data, right? Everybody who needs to interact across this ecosystem that I've just painted the picture for you here today, they need to be able to update and store data, normalize and code data, and then leverage data for the purposes of efficiency and improvement, including more and more often now the conversation about artificial intelligence and how we can leverage that for more effective decision support. So we're often running on the development of something called the Health and Social Care Data Institute. It's a new thing in Northern Ireland, and it's that concentration of capability, platforms, skills, data engineering and data analytics, but also more importantly, the evangelism. How do we get the capability development that Edelweiss talked about so that people can leverage data in the work that they do day to day and then more broadly in the work that we do as a system to drive forward both on outcomes and productivity. If you want to know a bit more, I did point you towards our strategy earlier on. A couple of things that you might want to look at if you're interested. This is a terrible URL, dhcni.hscni.net, or if you just search in Google for DHCNI, you'll find it. So that's the thing on the left of this slide. It's the website for my team, Digital Health and Care Northern Ireland. Everything I've just told you is explored in more detail there. We also have a TV channel on YouTube, dhcni.tv. So if you're interested in looking at videos of people talking a wee bit more about the work that we're doing and how we're doing it, then you can jump on our TV channel for more detail. Thanks very much. And again, it's such a privilege to talk to you. Thanks for coming to the conference.
Mic working? Yes. Thank you so much, Dan. We each have our observations, and we probably have a number of questions. Please, we encourage you to use the app and send questions in. Edelweiss is tracking them, and we'll be able to put them forward. A quick kind of nugget in everything you said is the effort to release time to focus on care and connection, and how we need multiple parts to work together to enable that, and also the integration of all parts of health and care, including education, policy, home care, in the home. And when we think about the opportunity that sits in front of us and where we're at today, and the opportunity around where we have the opportunity to move, and the examples both Birthe and Dan gave, I'd like to introduce you to our panel. Joan, described as herself as a service user. Richard from Carers Scotland. Helen from the Bevan Commission. And Carolyn Steele-Gray, chair in research related to technology and health. Helen, starting with you, share your thoughts and reactions to what you've heard and the opportunity that sits in front of us.
It's amazing, isn't it, when we hear all this stuff, and it's amazing to hear all the ideas that we've seen around today and over the last few days. Sometimes it's a bit overwhelming as well, isn't it? And you sit there and you think, how are we going to do this? One of the things that we've been doing as a commission is looking at the future. So if you think 20 years from now, we are going to see substantial changes in our demographics. Something in the region of an increase in over 90-year-olds. We're going to see something in the region of something like 87% increase just in that demographic, and all the others relating to it. We're going to see, therefore, more complexity. We're going to see the challenges that come along with that. But we're also going to see an aging workforce, and possibly increased, if you like, absence from sickness. Alongside that, we're actually seeing a significant reduction in fertility rates, which means we won't have people coming behind. We won't have, let's say, the taxpayers coming to pay for it. But there is a real challenge. So change is not an option, and the stuff we are seeing and hearing is absolutely critical to that future. The dilemma we face, I think, is in not knowing what we need to do, and we say this as a commission, we know what we need to do, we've said it time and again. It's how on earth do we make it happen? And we were reflecting the other day, something like about 80% of change is about individuals, people, whether they be the public, patients, professionals. And it reminded me of a conversation that I had with, we like to learn from industry, and when the banking industry went online, and we all do it now automatically, but one of the things that they identified was a real failure was they actually didn't engage their staff, and they didn't prepare the public. And so the two things they did, which was really interesting, one, they took the tellers from behind the counters and helped people with the technology. And the second thing they did was use young employees, they're 18 and 19 and 20-year-olds, to support and inform their older employees with the technology. And I think we've just got to be really creative at how are we going to make this work in practice that will be the real challenge. We know what we need to do. And I think there is also this urgency. Come back. The urgency of doing it now. And we heard it earlier from Birthe. She said, just do it. We have just got to do it. We've got to learn as we go. We've got to use our intergenerational partnerships much more than we do. And we've got to be really creative, bold and brave to just do it. And, I write lots of papers, and one of the things that we've learned, papers will not change the world, strategies will not change the world. It's you guys. So when you go back to your places of work, what are you going to do to enable some of this stuff? What's going to be your story as you go back? We identified 4 key enablers to the future if we're going to really have a sustainable health and care system. One of it was partnerships. No, we can't do this alone. Whether it's partnerships with industry, whether it's partnerships with each other or the public, it doesn't make any difference. Partnerships are really critical. Technology is absolutely essential, and we need to work and follow in the footsteps of people to understand their journeys in this. The third one is data. We do not use data to inform and shape our services. And the fourth one is that workforce, whether they be members of a professional group or, in fact, members of the public. I think we need to do much more to ensure that we get their ideas, as well as our ideas, into this. So it's a complex picture. It's a necessity. We've just got to do it and learn as we go. And remember, people are the ones that will make this happen, not the strategies and papers. Thank you very much. That's mine.
Thank you. 80% of the change comes from us, individuals. I'm holding that sacred. This is a brave space, naming what's really important that we hold and do. And we've identified, and Helen's identified, what doesn't work is when we're disconnected from the change ourselves, when it's structures and processes and papers that guide change and not the experience of each of us. Banking industry is a really good example. And we think about connection, meaningful connection as the correction. Joan, a warm welcome. Please introduce whatever's important to you, to all of us, and to share with us your thoughts and reactions and what's important.
Thank you very much, and thank you for inviting me to be part of the panel. As Dan said, I've been privileged to be involved with Encompass at the regional board level, the engagement group, which is purely service users, but more importantly for me as well is I was asked to join the South Eastern Trust Encompass board because our trust was the first to go live last year. So I've seen what it is at the coalface that people have to go through about the hard work that's put in to actually, everybody's talking about how easy this is going to be. Trust me, it's not. I witnessed the tears, the tantrums, and that was just for me. But also, I've seen the difference that it's made because I've got the MyCare app, the patient portal, and it's made such a difference to my communication. It's made such a difference. My husband's on it as well. So we get the up-to-date information. Like everything else, there's teething problems. It's, you know, no technology is going to get it right straight away, but it has changed everything. It's fundamentally for the best because at the end of the day, it's about all of us because we're all going to be a user of service. We could all be carers. So we're invested in this. And I think from my point of view, what has been a privilege as well is, for once, the higher echelon have decided that actually, do you know, we need to talk to people on the coalface. We need to talk to the patients and service users who are involved. No disrespect, Dan. But this is about us, because if it's not going to work for me, why are we spending a lot of money on a system that may never be engaged with? I remember what the run-up to the Southeastern...
Try again.
No, it's back on again. Yeah. I think it's maybe telling me to shut up. No.
Hello?
I remember what it was like in the run-up, the meetings that were held, the staff engagement that took place, and occasionally I was the one in the room went, excuse me, how do you think that's going to work? How do you think you're going to get that message out? And one of the important things that we looked at was when Encompass went live for the trust, do we do the big launch of the MyCare app? And I couldn't see the point in that because staff were going to have to come to terms with something that was completely different. And believe it or not, we still haven't done the full This Is MyCare app, all singing and dancing. And to date, there's about 10,000 people have signed up for the app. A lot of it may be curiosity, but it's already been used. And a colleague that I was on the board with shared a story with me that she had been approached by a gentleman that was in his just turned 80 and thought my care was absolutely fantastic. We were worried on the board that maybe elderly wouldn't engage with it. Trust me, and I'm in that category, we have taken it on board. I want to say thank you because it's going to change what we do over here. I think it's going to make it important that our voices are continued to be heard and that actually staff are appreciated and are listened to. And for me, that was evident because I saw how much went into the effort of making sure that staff were trained, they understood that was happening, and when the launch happened at 4 o'clock in the morning, thankfully they didn't ask me to attend because there's no way I was getting up that early. But I saw everybody afterwards, so for me it's a game changer, and for staff, anybody that I've spoken to, whether it's to do with my care or my husband's care, have really said that, in another 6 months it'll be paper. What paper? So it's been a privilege to be part of the board level, but as a user of it, it's just amazing what it can do for us. And it'll take time, but we'll get there. Thank you.
I'm experiencing our conversation as build. No. I'm experiencing our conversation as a build. Do you hear me? No. Let's try again. I'm experiencing our conversation as a build. We talked about the possibility that's sitting in front of us and the gap that exists between the way we engage in a meaningful way with technology, improves care, and it improves the experience of people that work in health and care. And Joan, thank you for sharing your personal experience and really the wise advice that's been building and that we all talk about but don't often name or not name enough or not build it into the way we actually create change that enables digital approaches to be useful, is that if it's not designed around what's actually going to make a difference for you and your family and the 10,000 people that have signed up, then what's the point? And so profound to hear you say, people wonder if it's making a difference. I know it's made a difference. Richard, as leadership for Carers Scotland and reflecting on the conversation we're had today, please build on this and add what's important from your perspective and from Carers' perspective as we continue to move forward. Patterning, as Bill Sharp will say, there's 3 horizons. The first horizon is when we're maintaining the status quo, or despite what we say, our actions are still past maintaining. To the second horizon, where we start to pattern our possible future. We've already started to hear the areas that are most important to achieve our possible future, which is one that we're building towards what is possible. And let's hear, Richard, your thoughts.
The microphones know the conference is coming to an end and they've just had enough. They're ready for a nap. I'm going to talk to you about unpaid carers, and I'm going to go back to the title a little bit of this plenary, which is Making Integrated Care Happen and Supporting the Health and Care Workforce, because we really need to think of unpaid carers as part of that health and care workforce, because their contribution is huge. In the UK, there are currently over 6 million unpaid family carers, and that is pretty much double the combined health and social care workforce of the UK, which I think is about 3 million. And if you were to put that into an economic contribution, which we've done, carers in England and Wales, which is part of the UK, contribute about £162 billion a year in the equivalent of health and social care costs. When you put that against the NHS budget for England, which is about 180 billion, that's huge. And actually, Dan put up on one of his slides that the trusts in Northern Ireland have a budget of 55 billion. Well, the economic contribution of unpaid carers in Northern Ireland is 5.8 billion, so more than what the 5.5 billion for the trusts. So unpaid carers really have to be considered equal partners in that care. And I think, again, Helen talked about demographics. Demographics is hugely significant. We know that the population is getting older and that they're living longer with more complex conditions. But we're also seeing, and have done for a while, that shift from acute care into community care. And that, again, and particularly into home care settings, puts a lot of pressure on unpaid and family carers to bridge a lot of the care that can't be provided by statutory services. So these are huge challenges, and unpaid carers absolutely must be part of those solutions. And actually, the digital solutions can play a huge role in that. Firstly, digital records are absolutely crucial. I think what we're seeing are some really innovative ideas, and my plea is that carers are fully part of those processes of developing digital records. Firstly, they're a great opportunity to actually identify a carer. For somebody that's getting a digital record set up, maybe through a conversation with a practitioner, actually identifying that carer and having them known on the digital record. But also, that carer has huge knowledge and understanding of the person that they're caring for. It's invaluable, and to be able to share that in perhaps a digital record, so giving carers the right to see records, to contribute to records, to upload information, that is invaluable information for care teams, and will really help increase the chances of positive outcomes. But also, I think with that, we need to think about how we provide training and education and support for carers to use those digital tools. Again, I think it's been great. Knowing I was sitting on this panel, I did spend more time in sessions where we were talking about digital solutions, and I've been really reassured by the fact that a lot of these programs out there are actively exploring the role of family caregivers and unpaid carers. But of course, it's really inconsistent. It's not universal. It's only emerging. It's not spread. So for many, they don't get this access. They're not identified. And beyond digital records, if we're looking at digital platforms and digital solutions, and these can be hugely important for unpaid carers, it can be sources of information, knowledge, training, education, sharing good practice, peer support, networking support. All of these things can really help carers. We know that carers, in many circumstances, aren't able to maybe leave the person they're caring for long periods. They can't leave the house. Time pressure is huge. They don't have time to nip out and do bits and pieces, but digital platforms can actually really give them an opportunity to engage. It can actually even give them the opportunity to participate in labour markets, to actually be able to continue to work in employment. But also, again, it is those opportunities to provide and get information on healthcare and support to potentially care queries, all through those digital platforms. So there's a huge power in digital solutions and what it can do to support unpaid family carers. And my plea is that to all those that are involved in developing digital solutions to integrated care is to treat the unpaid carer as part of that integrated care team, and to really maximize the skills, the knowledge, and the understanding that they have, and to recognize and value their caring role.
When we think about when we walk away from here today, what is our opportunity to take some of the lessons? I know for IFIC, as an organization, we don't want to have our conferences without equal partnership of clients, patients, and carers, and what we ask of everybody who comes forward. That's an absolute design principle in how we move forward. Because of that reason, it takes us actually holding space and putting what we think is important out there, and not having just individual voices that represent community members or carers, but all of us, ensuring that it's in the design of how we move forward. We have asked Dr. Carolyn Gray-Steele to join us while we've been at the conference. I know Carolyn very well. She is a chair in research for implementing digital health innovation. And as you sort of hold a light around possibility and in the work you do, can you reflect on your own experience, but what you've heard from today and what our opportunity is? Carolyn.
Thanks so much. It's been so wonderful to hear all of the reflections today, and I'm really happy to have the opportunity to think about that. And one of the things Jodeme asked me to do today is to try to kind of bring together the different conversations we've heard, because I guess I have a reputation of doing that, of bringing different ideas together. And what I really liked is that we went through the gamut of clinical to system level thinking in how digital technologies can support integrated care. We heard about digital infrastructures and how you need to think about the broader view. We heard about the models of care and different examples on how to do that. But then we also heard from a clinician, we heard from a patient, and we heard from a caregiver perspective about what that means to actually receive care well. And then we got a compelling question around how we do that. And as I think about the conversations that we just had, it comes back to a conversation we've been having in some of our writing around thinking of technology as a team member. So you have the architectures and the models of care, that's the backbone. But if we think about the technology we're putting in place as a team member for people like Edelweiss and our caregivers, what is the role that they're playing to serve Joan? And are they being a useful team member? Are they asking too much of us in cognitively engaging with too much information that reduces our ability to communicate very well with each other as a team? And being very mindful about the role that it plays to be an enabler of care as opposed to maybe a toxic team member. And I think we see examples of both of those things happening. So being very meaningful and purposeful about not just the function of what technology is doing for us, but the way it's enabling communication, relationships, and trust with our providers and with our patients and caregivers, I think will go a really long way to allow us to make the most of it without leading to additional cognitive burnout and overburden.
Thank you, Carolyn. How can we see technology as a member of the team? Very profound and a wonderful way to share observations. How to see technology as a member of the team and how you knit together your observations, and obviously the final compelling piece for all of us is how might we in fact see technology as a member of the team and either a positive, contributing, integrated member of the team, or as you said, watch out from becoming a toxic member of the team. You have sent in many questions. We are so grateful. We are at time. We will be able to respond to questions in the work we do as an organization as we move forward, and we're so grateful for the questions that did arise. To our panel, thank you from the bottom of our hearts for showing us not just the possibility, but the work that's already happening to lead the way. Thank you. And thank you to everybody for joining us, who's in the room and far away. We are now going to shift to our closing ceremony, and I welcome our Chief Executive, Neve and Fiona, member of the senior team, to the stage.
Thank you, and I invite our colleagues from Portugal and from Calgary, from Canada, to come to the stage as well. And while they're doing that, so I don't delay any further, I'm going to go through my thank yous. So first of all, I'd like to thank our own team at IFIC. They all play hugely important roles in the organisation of the conferences, both during the long, very long lead up to these type of events. We started planning this particular conference in 2019, so that's 5 years of planning to come to Belfast. Hopefully you'll have had the opportunity to meet them over the last few days, but you've seen how they've been contributing, doing the videos, doing interviews, chairing sessions, being at the exhibition stand, so hopefully you've had a chance to talk to them. A big thank you to Abby, our professional conference organisers. Again, they've just been absolute professionals throughout the whole experience. They're incredibly reliable. And in particularly, thank you to Chrissy Schroeder and Emma Conlon. They've been by our side the whole time. No task too great, and incredibly patient when I'm sometimes a bit short in my how I ask for things, so I apologise for that. To the Department of Health Northern Ireland, again, this has been a long journey. You're also going through your own long journey, so we appreciate your commitment to this conference and being there throughout the whole planning process. Particularly involving the community voice through Johnny Graham. I hope Johnny's still here, who is our patient representative on the organising committee, and to Danny Power as well from Belfast Learning Cities. We were able to connect with a number of community projects based here in Belfast and beyond, and hopefully some of you got to see them in the site visits. But I would like to take the opportunity to thank the East Belfast Community Development Agency, Ashton Community Trust, Bridge of Hope, the Healthy Living Centres, the Footprints Women's Centres in West Belfast, and the Lower Ormond Residents Action Group. We have taken some videos of them that you've been able to see throughout the conference, and you'll be able to catch up with them afterwards if you didn't get a chance to see those. I particularly want to say thank you to Martina Moore and her colleagues Vincent Ramirez, Stephanie Drury and Shirley Murta, who are all part of the organising committee and instrumental in making sure this conference went ahead as planned. Even though we had COVID delays, we had no General Assembly and other obstacles that they overcome to bring us here today. So a big thank you actually to Martina and her team. Finally, it's not just the organising committee that makes it happen. I really want to thank our board, chaired by Professor Anya Carroll, all our scientific reviewers, our scientific chair, Deirdre Heenan, who was part of developing the programme. We had 700 papers. It's a huge amount of reviewing, and the reason why the programme is good is because we have that expertise that helps us to design it. But lastly, it's a big thank you to you. You're the ones that have taken the time to write the abstracts, to prepare your presentations, follow all the instructions through our digital platforms, which I think are fantastic. But so thanks for your patience if they haven't always worked. But it's really important to recognise that you as delegates are the reason that this conference can happen. You see that we don't have big industry sponsorship. This conference is purely funded by your attendance. We're a not-for-profit. We don't make any big bucks from these events. They're hugely expensive and a massive risk. So you being here is why we can make it happen. We're also able to record the sessions and live stream. We were live streaming 21 sessions from this conference to people who couldn't afford to be here or had caring responsibilities or for whatever reason can't be with us in person. So we try to have an equitable approach to sharing the learning. So yes, a big thank you to all of you. And now I'm going to hand over to Niamh, who's going to give some closing comments. Thanks, Niamh.
Thank you, Fiona. And before I go into that, the one person she didn't mention, of course, was herself. And none of this would actually happen without Fiona Lyne. And she is ably assisted by Miriam Galvin. So, very importantly, I've got to announce the results of the gamification, which I didn't even know existed until about half an hour ago. So I wasn't taking part. I'll have to know that for next time. So the fourth prize, which is a ticket to the gala dinner at next year's conference, goes to David O'Shea. The third prize, which is 25% off next year's ticket, goes to Sharon Thompson. The second prize, which is a half-price ticket to next year's conference, it goes to Renzo de Gabriel. And the winner, who gets a ticket to next year's conference, was Trudy de Vries. So well done, all of you. So just very quickly, I'm just going to share my reflections on what a 3 days it has been. And this is always a really big challenge for me. I'm asked to come to this session at the end and suddenly synthesize everything that I've experienced over the previous essentially 2.5 days, but really full days. So how has this conference changed? Well, over time, I think we've seen a huge shift, and it's been really notable this year, from research and theory to much more around practice. A lot of conversations, and I was talking to Walter about this earlier, a lot of conversations about evaluation and how we're building in meaningful feedback loops into our systems around integrated care. And also more representation globally. So we've had more people from low and middle income countries at this conference than we have had before. Still not enough. We want to see much, much more of that. I asked some questions at the opening. So I asked you to think about and reflect on a couple of questions. How are people and communities actively and meaningfully involved in the implementation of integrated care? And are we really listening? And I can say, after listening myself to the last 2.5 days, there are lots of reasons to be optimistic about that. How will we know when we're successful in that? I'm a bit more optimistically skeptical or skeptically optimistic. I still think we are on a journey to really thinking about how we meaningfully measure that, and we'll know when we're being successful at it. But I was struck by something that Rafa Bangoa said in his opening about, and this comes back to my original role as a communication therapist. It's not always just about doing the talking and communicating the message. It's about understanding what it is that people are hearing from you. And we as a movement in integrated care need to get better at communicating the message of integrated care to bring people with us and not just talk in terms that we all understand and understand very well, but talk about integrated care in ways that are meaningful to the people we need to be convincing. And that is people and their communities, because if they're convinced, they'll convince the politicians and the policymakers to make the decisions that need to be made to make this real and do what we said we wanted to do in this conference title, which is take the leap. So that's my reflection. I'm going to hand back to Fiona, who's going to take us on the journey forward.
Thanks, Steve. So we weren't able to travel to Toronto in 2020 or 2021, but I'm delighted to say that we are going to be traveling to Calgary in Canada in October, and I'm going to hand over to Jodeme Goldhar and Professor Walter Woodchest to tell us a little bit more about that.
Thank you so much. We are bringing the conference to North America. So as you know, as part of a global movement for change, as IFIC has set out an agenda to bring together all of us around the world to advance integrated care as an enabler for health and well-being. We also recognize the need for hubs to be created where we could also connect up within local geographies. And you can see by the attendance at the conference, we have, as a result of those hubs and the additional connections being made, 50 countries represented here today. In 2018, Walter and I came together and said, how might we create the North American Centre for Integrated Care and the International Foundation for Integrated Care Canada, and have been partnering along with many other people to bring this to life. And what we've realized over time, now that we have over 5,000 people across Canada connected as part of this community, is it's our time to bring the next conference to North America. We're going to be hosting it in Calgary, Alberta, a province as part of Canada. And our hope and dream around the conference is thank you, more than bringing the conference to Canada. It is about how do we connect our global and international community with Canadians, and how do we connect up Canadians with each other and as part of the global community. And our focus, it's happening in October. We hope you will all come. Our focus together, should we try it, is 1, 2, 3. Creating health with integrated care.
That was good.
Because as we have discussed, this is really around our opportunity for health creation in our local communities and in our countries and around the world, and how can this be a lever for change? Our work is focusing on 3 areas that have started to emerge in this conference, and if we look at futures work, what is our future possibility? And as Neve said, we're optimistically hopeful, and even more so by being a part of this conference, to see what is actually happening, not just what we say we want, but what we're actually doing, and still the opportunity that sits in front of us. And as we heard from Helen from the Bevan Commission, 80% of the change depends on each and every single one of us. And so we have to ask ourselves, what is the work we each need to do to evolve, to grow, to learn, to unlearn, in order to move forward in a way that honors the possibility of health creation? So one major focus is on the human level, our individual work that we need to do, and our collective work to shift our mindset and our behavior and to increase our capability for impact. The second focus is relocating focus on community and community health and well-being and community-enabled change. And we're really shifting and looking at distributed power and how to make power equitable and accessible and co-designing the future together, and understanding that if we want community health, and if that is what we all say we're in service of, then how do we focus on community and the power of communities? And the third piece is, we all know, those that are in the room, but for those that aren't in the room that are interested, is we are creating new operating systems in the way we work. We just heard that we're looking at digitization as a member of the team, and who else is part of a team that we have to integrate at the point of care, but also across organizations and across health systems. And we'll do a very deep dive and sharing and learning and reflection around what it takes to build integrated care teams.
And for all of these areas, we also have key priorities that cut across the themes. The first one of these is health equity. We really need to be sure and certain that we're really being attentive to equity. Who are we reaching? Equity deserving populations, minorities, people of other languages, cultures, and how do they have their needs met by our models? Person and community partnership. We need to be co-designing with the people that we're really trying to enable and support and help. And we have many, many caregivers and patients, clients, persons here who are really helping do that work. We need to make sure we do that broadly, widely in all of our work, bringing that centering. And also, as Neve had talked about, enabling our advances in our knowledge creation through evaluation. How are we evaluating? What are the models? And every time we do something, we should be thinking about how are we creating knowledge with this through evaluation. We are always going to align to the 9 pillars. And so we're interested in submissions for abstracts, which are now open, aligned with the 9 pillars of integrated care as well. So think about your work and how does it align, and we'll help organize the whole program around the 9 pillars of integrated care.
Our opportunity is to think about, and like we said before, and like we hope takes place in every country we go to bring the community together and further build our sense of ability to make a difference individually and collectively. Our hope and dream in Canada is it further ignites possibility. It shows our collective capability to make change, but it also inspires each of us to move forward together in a very different way than perhaps we came into the experience, similar to where we're holding space today. And this can't be possible without partners. Walter and I and our principals and with our executive which includes carers and clients or residents of communities, is that we don't want just sponsors, although sponsorship is helping. Each of these sponsors and many more that are forthcoming are part of our collective community to bring this to life and the possible impact that we have for change in Canada and across the world. On behalf of both of us, we're so proud to bring this to life. And we'd like to now share with you our video, which will share what is the opportunity that sits in front of us from many of our team's perspective. So please, to the video.
The time for advancing people-centered integrated health services is now. The conference is a phenomenal opportunity for people from around the world to come together, connect, learn, engage, stimulate new ideas.
We're bringing this conference so that we can connect up Canada with North America and the rest of the world, because we have so much to learn from one another. We have chosen 3 areas of focus for the conference, entitled The Human Level Transformation That is Necessary for Integrated Care, the Health and Well-Being in Communities, which takes us to our 3rd area of focus. In order to do all of this, we have to break down barriers across all parts of our healthcare systems.
And across all 3 themes, we have consistent priorities. Our first area of priority is health equity. The second is co-design with persons and caregivers in collaboration. And the third is evaluation.
The NACIC 2024 conference is meaningful to me because of the importance of improving integrated care in our society, especially for those with permanent disabilities.
It's imperative that we move integrated care closer to home, out of hospitals and long-term care settings.
I'm very excited about the NACIC conference. I think we're at a really great tipping point, in particular for how we think about digital health technologies and data that can support the way we drive our models of care, the way we think about caring for patients directly, and the way we work together as teams and across organizations.
Moving that integrated care closer to home in the community is what's going to make our health system sustainable.
Our constraints and our challenges are common, no matter what area you're living in or what catchment you're supporting. And so for me, the conference is an ability for us to compare notes, to share, and to grow the opportunities of integrated care at scale.
By getting everyone in the room together, we can really learn, we can think, we can challenge each other, we could really think about how we can advance the system so we can stop kind of perpetuating the same challenges and issues we've had and really build something better together.
I think we're trying to solve a lot of the same problems, and we don't always get the opportunity to talk about those shared problems and come to solutions together.
It will provide exposure on a wide variety of integrated care topics to people who otherwise may not have the opportunity to attend the international meetings?
I think connection. That's really what it's all about. It's about learning. It's about, going to really exciting sessions and, learning new things, but also just connecting and networking and building partnerships so we can move ahead and do work together going forward.
The biggest impact is making more friends. I think it's going to be great for us to get together and meet people we haven't met before, and coming out of this, stay connected.
I just love IFIC conferences. They are my absolute favorite.
It's a new and emerging area for us in North America, so I think people will be really, really excited and interested to learn more about integrated care.
The conference brings people together just like integrated care brings people together.
Lots and lots of informal conversations with colleagues from across North America and even globally, I know.
I'm looking forward to encouraging everyone to go to as many different talks as you can so that you can not just learn about the topic, but again, meet some incredible people who are doing some incredible work.
Every time I come away with new knowledge, new networks, and a new perspective on something that felt a little intangible or a challenge that I was really kind of knocking my head against a wall about. So I think others can expect the same thing.
It's our opportunity to learn together, unlearn together, grow together, and have impact together.
With patients and families in co-production of the future of integrated care.
It really is the best conference of the year.
The conference will encourage them and motivate them to start working with all the components of the health and social care systems to provide good care to people.
Everybody should come. It's in Calgary, too.
We look forward to seeing you in Calgary.
Join us at NACIC 24.
Creating health with integrated care.
Join us and be part of creating healthcare solutions and experience the excitement and networking opportunities the NACIC 2024 will undoubtedly involve. We invite you to NACIC 2024.
Now, if that wasn't exciting enough for you, I'm delighted to say that the ICIC, the European Conference, is going down to Southern Europe next year. We've spent the last few years in the north following COVID, so I am very excited to be going to sunny Lisbon in Portugal, and I welcome Dr. Adelaide Velo to tell us more about it.
Boa tarde. Good afternoon. Ladies and gentlemen, I must put my glasses. Esteemed colleagues and honored guests. As we conclude the enriching sections of ICIC 24, I stand before you filled with gratitude and excitement. Gratitude for the insightful discussions and shared learnings, and excitement for the promising path ahead in advancing integrated care. I'm thrilled to announce that the International Conference on Integrated Care will continue its legacy next year in the vibrant city of Lisbon for ICIC 25. As the host city, Lisbon promises not only its captivating charm, but also a stage for groundbreaking dialogues and collaborations in the realm of integrated care. Our theme for ICIC 25 is Synergizing Health and Care, leveraging integrated care for a sustainable future, reflecting our commitment to fostering collaboration and integration across health and care continuum. This synergy is essential as we strive toward a sustainable future in healthcare, balancing quality of care with efficiency and resilience. Soon, we will be opening the call for abstracts, inviting you all to contribute your innovative ideas, research findings, and best practice to shape the agenda of ICIC 25. We eagerly await your submissions as your expertise and insights are crucial in driving the evolution on integrated care globally. Now, let me share a glimpse of what is happening in Portugal that makes Lisbon an exciting destination for ICIC 25. Portugal is currently undergoing a transformative journey in integrated care. The entire country is now covered by integrated care organizations where primary and hospital care operate under the same board. This collaborative approach includes a representative from the municipality on each board, fostering a cohesive and community-centric model of care. Moreover, Portugal has implemented a national population risk stratification system and a risk-adjusted capitated-based payment model. These initiatives promote personalized care, efficiency, and sustainability aligning with our theme of synergizing health and care. So we can say that Portugal is now an integrated living lab. By hosting ICIC 25 in Lisbon, we aim to showcase these innovative initiatives, exchange global perspective, and collaboratively chart the future of integrated care. Together, you can build a future where integrated care is not just a concept, but a live reality, promoting health, well-being, and sustainability for all. In closing, I invite each of you to join us in Lisbon for ICIC 25, where we'll continue to build bridges, share knowledge, and inspire change in integrated care. Let's synergize our efforts, foster collaboration, and pave the way for a sustainable and inclusive future in health and care. And now I ask for my colleagues to join me so we can ask to go.
Hello everyone, greetings from Portugal.
We would like to welcome you to the IFIC 2025 here in Lisbon. Portugal is a country with great people, with good weather and great places to visit. But Portugal is also facing a great transformation of its healthcare system. We are just creating 31 new local health units, which are integrated vertical organizations that merge primary care and hospital care. So Portugal at this moment is a great integrated care live lab.
Sustainability was in good time chosen as the main topic for the Congress of 2025. In terms of environmental sustainability, integrated care has a huge impact in the reduction of the patients' itineraries, overdiagnosis and overtreatment, and these are significant determinants of the ecological footprint of the healthcare sector. This and other themes will be discussed in Portugal next year.
The Portuguese healthcare system is undergoing a transformation forward integrated systems nationwide. ICIC 25 provides an opportunity for stakeholders to come together, share knowledge, exchange ideas, and create networks contributing for this transformation process.
Care integration is absolutely essential for creating a more sustainable future. It optimizes resources, it decreases redundancies, and it improves patient outcomes. Digital technology plays a vital role in achieving these goals. It facilitates communication, data sharing, and care coordination. It gives access to holistic, patient-centric care at scale, regardless of geographical barriers.
PAFIC, the Portuguese Association for Integrated Care, we are delighted to partner with IFIC in bringing this initiative to Lisbon. We are confident that your visit to Portugal and Lisbon will be an unforgettable experience. We look forward to welcoming you in May 25 in Lisbon. See you.
We would like to invite you to come to Lisbon, and we are thrilled to host here this IFIC 2025 and share with you all the scientific evidence about this reform that is happening here in Portugal.
Lisbon is a fantastic city and Portuguese people is very friendly. So welcome to Lisbon.
So welcome to Lisbon next year and join us.
Come to Lisbon
next year.
That's it. Look how lucky I am to get to work with all these wonderful people. It's so exciting for me to move from country to country because I get a new bunch every year. It's fantastic. And sometimes I get to revisit. So that's it, unless any of you have any final words. Thank you. Safe traveling home. Thanks for spending so much time and being patient with us when sessions were full and giving your attention to the speakers under pressure. It's been a fantastic 3 days, and thank you again.